Hi, I am Dr. Rasya Dixit. I am a dermatologist working in Bangalore from the last 18 years. And today I am here to answer all your questions about skin and hair related queries. Now that we are in the age of having multiple ingredients, we all want to know which are the products that we can use together or which are the products which don't work well together. So coming to the combos which is very popular, it is niacinamide and vitamin C. Both niacinamide and vitamin C are anti-inflammatory in nature. Niacinamide reduces the redness, vitamin C increases the glow, and they are absolutely people favorites. Yes, niacinamide and vitamin C are both can be layered together and they can actually available in most combinations together. So if you look at most of the vitamin C's nowadays, they already contain niacinamide. But if you have a pure niacinamide and a vitamin C, definitely you could use them together, one on top of the other, and either could be applied first to help your skin get its daily dose of glow. Most dermatologists are not great fans of toners. This is because toners are astringent and they're alkaline and the skin pH is acid. So unless you have really greasy skin, most of the dermatologists will tell you to skip the toner step. The correct order then will be serum, moisturizer and sunscreen. Serum first and then allow it to be dried and absorbed into the skin. Then apply the moisturizer on top of it. Wait for 10 minutes before you apply your sunscreen. We had a discussion about how many products can be used or layered on top of each other. What happens then? It is like when you're trying to sit in your office and do your work, when you're getting continuous email messages, the phone is ringing, your mobile is showing up WhatsApp messages, Instagram messages. So when you use multiple products, your skin also gets too many messages. So you may not get the satisfactory results. So which is why we prefer that instead of piling up products, use a product which may have a combination of like-minded ingredients. For example, some products have already got vitamin C, niacinamide and hyaluronic in one bottle. Instead of buying 3 different bottles and layering it up one on top of the other. The other important thing is using many layers of ceramides, hyaluronic acid, moisturizer, night cream can also increase the amount of blockage of pores and clogging of pores and acne breakouts, especially in those prone for acne and also in those who are living in the tropical countries. For both these reasons, try to use a more minimalistic skincare routine and try to look for products which have a combination of these products. Dermatologists can guide you to choose these products which are more appropriate for you. There are some products which are a complete no when you try to use them together. The first one would be retinol along with alpha-like hydroxy acids or beta-hydroxy acids, and alpha-hydroxy acid and beta-hydroxy acid with any exfoliation which is being done, physical exfoliation being done. These are the reason why we don't combine retinols with these is because both of them are causing an increased turnover of the skin. And when we have an increased turnover of the skin, you're going to have your skin becoming more sensitive, more dehydrated. So these are the combinations we definitely tell you to avoid. Remember also to avoid using retinols along when you are planning a pregnancy or you're in that phase where you're going to not sure whether you're going to become pregnant or not. Hyaluronic acid usually blends well with most of the products, vitamin C, niacinamide, retinol, and does well with all these products. Vitamin C, it does well by itself and can be used on alternate nights with a retinol and does well with niacinamide as well. Multiple skin serums have become the order of the day, especially because of the boom of Instagram influencers who tell you that you have to use this serum and this moisturizer. So ultimately your skin has to listen to the message which you need to give it, and the person who can guide you on what is the optimum skincare which your skin needs is your dermatologist. So no, you don't need all these products. You need a basic moisturizer, cleanser and sunscreen, and you need maybe 1 or maximum 2 serums at bedtime. So to understand what serum you need to understand the skin goal. Is it pigmentation you're dealing with? Is it seborrhea or oiliness you're dealing with? Is it blackheads that you're dealing with? Are you dealing with inflammation or rosacea? So based on that, the skin dermatologist can make a prescribed skincare routine for you. And no, you don't need all those serums, you probably need just a couple of them. When you have a busy schedule, remember to keep your layering in the morning very simple. So you do your face wash, moisturizer, sunscreen, and maybe if you want to use a hyaluronic acid serum, it can go on immediately before the moisturizer. And at bedtime, you would do face wash, you would do serum, and you would do moisturizer or a deep night cream. So this is as simple as that. I am talking about a 3 or a 4-step routine which will keep you from not skipping your routines just because it's so elaborate or long, and it will make sure that you are compliant and you achieve your skin goals.